Welcome to Understanding Dementia Types and Symptoms Explained. In this video, we'll explore what dementia really is, clear up common misconceptions, and offer guidance on recognizing its many forms and symptoms to begin our journey with compassion and knowledge. This way we can better support you, the caregivers we call Earth Angels, through the journey with your loved ones. When we hear dementia, we often think only of memory loss. But dementia is more than that. It's an umbrella term for many conditions caused by changes in the brain. These changes affect thinking, reasoning, and daily life, making independence difficult. Symptoms vary. Some struggle with planning, others with mood or language. Understanding dementia's complexity helps us support loved ones with compassion and clarity. Remember, it's about seeing the person beyond the diagnosis. Alzheimer's disease is the most well-known and most common type of dementia, accounting for a large majority of all cases. Its primary hallmark is the impact it has on memory, especially the ability to learn and recall new information. You might notice a loved one repeatedly asking the same questions or forgetting recent conversations and important events. This happens because Alzheimer's typically starts in the part of the brain that controls learning. The disease is caused by the buildup of two proteins called plaques and tangles, which disrupt communication between brain cells and eventually lead to their death. It's a slow, progressive disease that may unfold over many years. Another major type of dementia is vascular dementia. Unlike Alzheimer's, this form isn't caused by protein buildups, but by problems with blood flow to the brain. Think of it like a plumbing issue. If the brain doesn't get enough oxygen-rich blood, its cells can become damaged or die. This can happen because of a major stroke or a series of smaller, often unnoticed strokes. The symptoms of vascular dementia can appear more suddenly than those of Alzheimer's. Difficulties with planning, making decisions, and slowed thinking, sometimes referred to as brain fog, rather than severe memory loss at the outset. When we compare these two, the onset and progression can be quite different. Alzheimer's often presents as a gradual, steady decline in memory and other cognitive functions. A person might slowly lose their way in familiar places or struggle to find the right words in a conversation. The changes are subtle at first but become more pronounced over time. Family members might describe the progression as a slow fading of the person they once knew. This steady decline is a key characteristic that neurologists look for when diagnosing the specific type of dementia, as it points toward the underlying cause being the plaques and tangles of Alzheimer's disease. In contrast, vascular dementia often follows what's called a stepwise decline. This means a person's abilities can remain stable for a period and then suddenly drop after another small stroke or vascular event. These sudden changes are a telltale sign. For example, a person might be managing their finances reasonably well one month, but after a minor silent stroke, they may suddenly be unable to balance their checkbook. The symptoms are directly tied to the part of the brain that was deprived of blood, so the presentation can be very diverse, from physical weakness on one side of the body to significant problems with judgment and reasoning. Now, let's talk about Lewy Body dementia, often referred to as LBD. This is the third most common type, and its symptoms can be quite distinct. LBD is caused by abnormal deposits of a protein called alpha-synuclein, the Lewy bodies, in the brain. One of the most unique symptoms of LBD is the presence of vivid, recurrent audio or visual hallucinations. A person might hear strange sounds or see animals or people that are not there. Another key feature involves significant fluctuations in attention and alertness, which may cause agitation. Someone with LBD can seem clear and engaged one moment and then appear drowsy, confused, or unengaged the next. They may often get agitated easily as they realize their brain isn't working the way it used to. These episodes can change dramatically from day to day or even hour to hour, especially in the early hours of the evening. Frontotemporal dementia, or FTD, is a bit different because it tends to affect people at a younger age. often between 45 and 65. As its name suggests, FTD affects the frontal and temporal lobes of the brain. These are the areas responsible for personality, behavior, and language. Therefore, the earliest symptoms are often not memory loss. Instead, you might see dramatic changes in a person's personality and behavior. Someone who was once polite and reserved might become impulsive, say inappropriate things, or lose empathy for others. They might also ignore responsibility, spend money frivolously, develop problems with language, struggling to speak fluently, or to understand what others are saying. The physical symptoms of Lewy body dementia can also be a significant clue for diagnosis. Many people with LBD develop movement problems called Parkinsonisms that are very similar to those seen in Parkinson's disease. This can include muscle rigidity, a shuffling walk, expressionless face, and tremors. The combination of cognitive decline, hallucinations, and these Parkinson's-like motor symptoms is what makes LBD a particularly complex condition to manage. Consulting with your neurologist and providing all the symptoms will provide the proper diagnosis and treatment plan. The fluctuating nature of the cognitive symptoms can also be very challenging for caregivers, as they never know what to expect from one day to the next, making consistent care and communication difficult. For families dealing with frontotemporal dementia, the behavioral changes are usually the most distressing and challenging for the caregiver. It can be heartbreaking to see a loved one's personality alter so fundamentally. The loss of inhibition can lead to socially awkward or embarrassing situations, and the decline in empathy can strain relationships with family and friends who feel the person no longer cares. Because memory can remain relatively intact in the early stages, the changes are sometimes misattributed to depression, stress, or other psychiatric issues, which can unfortunately delay a correct diagnosis and the implementation of appropriate support strategies for everyone involved. If you notice any of these symptoms, whether it's memory loss, personality changes, or problems with movement, in a friend or family member, it is incredibly important not to ignore them. These are not normal parts of aging. The first step is to schedule an appointment with a doctor, who will likely refer you to a neurologist. A neurologist can perform necessary tests, including brain scans and cognitive assessments. Getting an accurate diagnosis is essential for creating the right treatment plan, as treatments and medications can be beneficial for one type of dementia, while harmful for another. There is a wealth of information and support available to help you navigate the path forward. Taking that step to seek a professional diagnosis and then connecting with these resources can make all the difference in improving the quality of life for everyone involved. If you want to know more, don't forget to like and subscribe to our channel and drop a comment with your question in the comments below so we can address it in a future video. If you or someone you love is affected by dementia, remember, you're not alone. Here are some trusted resources where you can find more information, support, and guidance. Alzheimer's Association, www.alz.org, Lewy Body Dementia, www.lbda.org, Vascular Dementia, www.vascularcures.org, Frontotemporal Dementia, www.theftd.org. The Alzheimer's Association 24/7 hotline is also a free service offering support for people living with dementia, caregivers, and the general public. Call 800-272-3900 for around-the-clock quick answers and support. There are also numerous online social media support groups available to communicate with caregivers around the world any time of the day or night. Just search Facebook for the one that best suits your needs. These resources are great for educational materials, helplines, support groups, and advice on dementia care and learning from other caregivers navigating the challenges with their loved ones. We encourage you to explore these resources and reach out for help whenever you need it. And remember, you are an Earth Angel. Remember to do something for yourself today too. Thank you for watching, and remember to like, subscribe, and share this video to support others in our Earth Angel caregiver community. And drop your questions in the comments below. Your questions today may be someone's answers in the next video. See you next time!